I'd like to call to order the study session of January 7th, 2026. Clerk, will you please call the roll?
Chair Bushnell,
Present?
Vice Chair Hitchin. Here. Board Member Herrera,
Here.
Board Member Mello,
Here.
Board Member Olson,
Here.
Board Member Ryasich,
Here.
Board Member Sadalge,
Excused?
Board Member Yonde,
Here.
All right.
roll call is complete.
Thank you. We have our one and only item is improving our study sessions with Kenny Villa. Come on up.
Thank you. Good afternoon, Chair Bushnell, Vice Chair Hitchin, members of the board. I'm excited to welcome you all to our first study session of 2026. And in my opinion, it's going to be the best study session for now. They're just going to continue to get better and better and better. And that's what we're here to talk about today. So I'm excited for this conversation. If you don't know, we do switch the study session and regular meeting in January to give our elected officials time to decide who's going to join us on the board in the future. So our regular meeting will be January 21st this month. So this is our study session. And this study session, as I said, we're here to talk about study sessions. So it's pretty exciting. Next slide, please, Pat. You can see the agenda here. It's pretty light. I want to spend a lot of the time talking, engaging, not necessarily looking at screens. That's what we're going to talk about today and going forward at some of our study sessions. We want to learn from you what you're looking for, what you want to find out more about, what we can help bring to you more often. We're going to talk about what that might look like. We're going to have a short activity, have some folks here to help us out with that. And then we'll come back for some time to brainstorm at the end and go from there. So, next slide. I got my notes here, but I'm going to try to, again, not be looking at the screen or papers as often as I normally would. But, what are study sessions? We normally have them, as I said earlier, on the third Wednesday of every month. They're really to help inform you as the board, especially when we have things we want to vote on at regular sessions or we're going to take action in the future. This is an opportunity for us to bring a lot of information to you ahead of time, give you a chance to digest it, ask questions about things, really dive into it. We don't need a quorum. It's great to see so many people here. And part of that is it's a little flexible. They're not technically required, but we still think of them as very important. It's an opportunity for us to bring a lot of information to you. We also, because of that flexibility, though, we're thinking of them in different ways, and we want you to start thinking about the study sessions in different ways, different things we can do. What does that look like? How can we think a little bit outside the box? We've talked about having some fun, being a little wild in different ways, but really, it's just rethinking. We don't want to be staring at the screen, presenting PowerPoints to you over and over and over again. And we really feel the study sessions are an opportunity to do that, more of different things. So looking forward to seeing what that's all about. Ultimately, when it comes down to it, as it says at the end of this slide, the study sessions can be and should be whatever we want them to be and you want them as our board to be. So that's why we wanted to bring this presentation to you, have this discussion with you as we're shaping what they look like in the future. So, next slide. So again, I've already talked about some of this, and I'm not going to spend a lot of time on each of these, but fewer presentations, less of us talking to you, telling you what we do, more of us showing you what we do, explaining it, having discussions with other people, bringing more people from around the department or even outside the department to come here and have discussions. Maybe we get rid of the dais and we sit around here and have conversations. We do all sorts of different ways to do it. We have a few things that we're still working through as far as limitations. We want to keep at least the first future of this in this room, and we want to keep a hybrid option for those of our folks who can join us, who can't join us in the room. But we also want to do some stuff where we're in the room. We can have some hands-on activities. There has been talks about maybe even taking a study session or a retreat out of this room, and we'd like to talk about some of those too, but we don't see every one of these meetings like that. But we really want to just think outside the box again and think about how we can bring you the best information that will prepare you to make decisions about public health in Pierce County. So more on that. Next slide. I want to hear a lot of your thoughts, and we're going to have about a 15-20 minute discussion. But before we do that, I want to start by having an activity. And for that, we're going to wash our hands. More accurately, though, we're going to learn how best to wash our hands. Again, we decided to kick off this discussion with the study session, new format, new ideas. I've invited Chris Matter to join us. Chris works in our environmental health division. She travels to schools to teach children the importance of hand washing. This is something that she's out in the community doing regularly. And we thought it would be fun to bring it here for a couple reasons. First and foremost, it's an example of exactly what I've been talking about you all getting a little bit more engaged and seeing some of the work that we do in the community and us showing it to you versus us just telling it to you, talking about it. But also, most importantly, hand washing is the fundamental building block of public health. We're in the middle of January. We're in the middle of respiratory illness season. One of the things that all of us can do to help protect ourselves and those close to us is wash our hands regularly. So we thought it would be a good activity to have with you all. And with that, I'm going to invite Chris up to walk us through how she teaches this out in the community.
Well, good afternoon, everybody. I'm in our Tacoma Smelter Plume or Dirt Alert program here at the Health Department. You might have learned a little bit about that before at Board of Health presentation, probably from Esther Beaumier, my boss. The Tacoma Smelter Plume is an area of about 1,000 square miles. The oldest Arco copper smelter that's where Point Ruston is located now, polluted that area with arsenic and lead, among other things. And we're concerned about arsenic and lead because they do, cause health issues. They are in the soil. They remain in the soil, north and west Tacoma, northeast Tacoma, and then all the way down through University Place, Lakewood, Stilican, into DuPont. One of the things that I get to do is I go out and offer free soil sampling for residents in those areas. I'll be in DuPont and North Tacoma tomorrow. I talk to homeowners and renters as well about where they use their yards the most. Do they have a garden, or do they want to start a garden? Do they have kids who play in the yard? Do they have a dog who always digs under one particular bush and, tracks that soil into the house? So I really am testing the soil in the areas where they have the most exposure. I am able to analyze that for arsenic and lead levels with a tool that we borrow from the State Department of Ecology. I let them know those levels, and then I promote the simple things that we call healthy actions, which are generally free or inexpensive things that they can do to reduce risk to their families from the arsenic and lead levels. So things like taking their shoes off in the house, or not tracking soil in, maybe wiping the dog's paws, when the dog comes in because they can't take their shoes off, covering bare patches in the yard where kids play with mulch or keeping good grass cover, and then washing hands well after they're working and playing in the yard so that they're not ingesting soil off of their hands. And so with the hand washing, I do also get to go into schools in the Plume area, talk to students, generally kindergarten and first graders, sometimes preschoolers and second graders. And I've done about 50 of those presentations over the last couple of years now that we've gotten back into the schools post-COVID. Walt Birdsall used to be a coworker of mine who would come along. His son Daniel is here at the health department still, and maybe you've met him. But Walt is he's a lovely man and also very musically talented. So he would bring his guitar and his harmonica, and we would sing songs with the kids. I still sing songs with them. They have to just put up with me a cappella. I won't suggest that we do that today, unless you really, really want to. But now I have a new coworker, Rihanna, who's going to be in the program with me part-time, and she'll be my hand washing helper. So I'm looking forward to having her out with me in 5 classrooms in Lakewood this coming Monday, actually. So the first thing that I tell the kids is that, we work at the health department, and ask them if any of them can guess what part of our job might be, since we work at the health department. And they get there eventually. Usually they might think that we're doctors or nurses, or just that we help people. And if they don't get all the way to that we, help people stay healthy, then I help them out with that. Let them know that we especially want kids to stay healthy, and that one of the best ways they can do that is by washing their hands well. So I tell them I'm going to ask them some questions, that we'll learn some new science words, that we'll sing those songs, and then do a cool science experiment at the end, which is just a black light experiment with some glowing lotion that you guys will all get to do today. So usually their eyes get big at least one of those things, either the singing or the science words. And then we get going. And the first question that I ask them is, what is something that could be on their hands that they would want to wash off? If anybody wants to play along, or if you just want me to, certainly we always hear germs. And sometimes if it's a second grade class, maybe bacteria or viruses. We talk about how you can't see germs on your hands with your eyeballs. You have to use a special science tool called a microscope. So they all learn how to say microscopic. I talk about how the science tool that we'll use later in our experiment helps them see something on their hands that they can't see with their eyeballs. The black light does that. We talk about dirt, and they will usually suggest dirt. This is the picture I show for that. I remind them that even if their hands aren't quite as dirty as his, that they can still have dirt on their hands. And depending on the age group, in addition to talking about how germs make us sick, and that's why we want to keep them out of our bodies, when I talk about dirt, I also let them know there are things in dirt that can make us sick. And that is the program that I'm in and why I'm out there. Depending on their age, I might talk about a smokestack and a factory and actually have them learn the words arsenic and lead. If they're younger kiddos, I just say, there are things in dirt that can make us sick too. We want to make sure we're keeping the dirt out of our bodies. And then they'll always say things like bugs and worms. And then a few more kids will raise their hands and say germs and dirt again. And then maybe we'll talk about, peanut butter, or after, if they've got some cool art projects up in the classroom, I'll talk about washing paint and glitter and things off their hands too. My next question for them is, when are the times that we, when it's important to wash our hands? They will usually say before they eat something. And we talk about how if you haven't washed the germs and dirt off of your hands before you eat, where does that go? It goes on your food and into your bellies and can make you sick. Often if I'm there, after lunch, I'll ask them who ate a sandwich for lunch, and did they, where did the germs go if they didn't wash their hands before they ate their sandwich? Or if it's Pizza Friday, nobody eats their pizza in first grade with a knife and a fork. So that's a good way to help them remember. After playing outside, they want to wash their hands. They usually remember that, since we just talked about washing dirt off your hands. The kindergartners invariably forget to say that they should wash their hands after they use the bathroom, but the first graders usually remember that, and I always help them feel proud that they remember. Maybe, after touching pets, after eating food, and then usually, as Kenny said, we're in respiratory season. They never remember that until I start achoo, fake sneezing over and over, and ask them if they can think of any other reasons to wash their hands. And then we do talk about that, actually, that, when I learned in first grade to cover my coughs and sneezes, it was like this, and probably for many of you too. And thankfully, that's not how they're learning anymore. And so we talk about reminding to do this. The last question I ask them is what they need to use to wash their hands. Many of them have said soap and water as answers to the earlier questions, just because that's what they think about when they think about hand washing. So we talk about that. We talk about warm water if they have it. Sanitizer almost always comes up. And it's kind of a delicate subject, honestly, in schools sometimes, because teachers don't generally have time to have all their students line up at the sink and wash their hands well before they go to lunch. So many of them are just getting a squirt of sanitizer on the way out of the classroom. That is a good thing, we want them to be getting the germs off their hands before they eat, certainly. But we do talk about how when they have access to soap and water, that's a better choice than getting the dirt off as well. They learn another science word, which is friction. You have them all put their hands in the air and rub them together really fast, and then tell me how they feel. And we talk about how you need lots of friction to make the bubbles, because the bubbles pick the germs up off your hands and wash them down the drain. And then we talk about how long to wash their hands for. And those guesses are comical. Sometimes I'll usually have at least one kid that I tell them, well, when you grow up and you're a heart surgeon, that is how long you will wash your hands for. But right now, 20 seconds is good. And these are the songs you can sing. Happy birthday a couple of times. Your ABCs a couple of times to do those for the right length of time. And then I teach them 2 new songs. Tell them they can sing those while they're washing their hands as well. One is to the tune of Row, Row, Row Your Boat, so the kids all know that. And the other one is Twinkle, Twinkle, Little Star. That one has a line that says, look how clean my 2 hands are. And I talk about just show your grown-ups how clean your hands are. Because they'll be proud of you, especially your teachers, because they know that you're trying to keep everyone in class healthy so you can all be there learning, keep your teacher healthy. And then we do our science experiment. So I remind them how you can't see germs with your eyeballs. You have to use the special science tool, and that they won't be able to see this lotion with their eyeballs. We'll use our special blacklight science tool. I make very sure to show them that this is called Glow Germ Gel, but that there are no germs in the lotion, and that I don't want anyone going home and telling their grown-ups that the health department lady came to school and squirted germs on their hands today. So make sure they remember that, because that has happened. And I will just do, if you all are game, I'll just give everybody a squirt of this. I don't think I need to tell you to all stand up and stay where you were on your pockets, but I'll just come by and give everybody a squirt. If you rub it in until you can't see it anymore, and then I think the light got turned off actually. So if you want, you might have to jiggle it just a little when you flip the switch. You'll look under the black light, your hands will glow, you'll go wash them, you'll come back and check again and see how well you did. And then we'll just kind of go over the same things I talked to the kids about at the end of the presentation. And then I'll tell you what's in the packets that they all get to take home, and you all are welcome to take one of those with you today if you'd like to as well.
While Chris is getting you set up with some lotion, I just was reminded of when I was here in the 1990s to get my food worker card, and they taught me to sing happy birthday to wash my hands. And, we do that online now, but it's been a long public health tradition, I believe. But yeah, so get them nice and good in your hands. And then we really do want you to take some turns, look under the black light, see what germs you got, and then go out here to the restroom and let's see, wash those hands as good and best as you can. Sorry for the folks who are online who are unable to participate. This is the type of stuff you're going to get to do at future study sessions and much more. So we're just trying to make you jealous by seeing all the fun in the room. But I'm going to turn off the podium or turn off this mic while we're working on that, and we'll be back to join you for a discussion here in a bit. All right. Looks like we got everybody back. Hands washed. Chris is going to talk a little bit more about the activity.
All right. It sounds like everybody did a good job. Okay. Which I mean, I would expect. So, and hope. Glad to hear it. I do, as the kids come back and gather on the carpet generally, and we kind of wait for everybody to be done, I talk to them about the spots that they might have seen lotion still. And then just kind of go over with the group. Like people usually, yes, the tops of their hands, fingernails, their thumbs. A lot of times your thumbs are kind of hanging out there by themselves, and they forget about their thumbs. I talk about palms, how you might think they look flat, but they're kind of bowl shaped, and then bumpy knuckles. And I suggest to the kids that they can use their knuckles on one hand as a scrubber on the other palm. And I've been really delighted to, because I visit kindergarten and first grade primarily, there are kiddos who remember me from their kindergarten class. And I've had more than once a kid show me, you taught us to do this last year. So at least a few of them are changing their behavior based on this. So, and then all of the kids get one of our packets to take home, and we gave each of you one. Our Dirt Alert brochures are in here, and I always tell them these are the boring things that they can get their grown-ups to read when they get home. But that they should look through and see which words they recognize too. There's an activity sheet in here, so if you have a little one in your life, you can share that. And then we used to have these really cool fish-shaped nail brushes that we aren't able to get anymore, but they'll get a fingernail brush to take home, and I tease them, is it for this or is it for this? And usually they get that, no, it's for this. And so I tell them just to ask their grown-up if they can put this at the bathroom where they wash their hands the most at home. And then we also share, I mentioned this is a healthy action earlier. We have these little door hangers that just remind people to take their shoes off in the home, because that can be a great way to reduce risk from all sorts of disgusting things that can be on your shoes. And I say, if their grown-up doesn't want to do that, maybe they can just hang it on their bedroom door and have people take their shoes off in there. So, yeah, that's that. It's fun. Walt and I think we had one day where we did 7 of these presentations in one day, and they're a half hour generally each. We were so bug-eyed at the end of it. Rihanna is getting thrown into the pool with 5 on Monday. So, but they're fun, and I feel like they make a little bit of a difference, and I'm happy that I got to come and share it with you all today. You're welcome.
Thank you. Awesome. Thank you again, Chris, for that. And thank you, board members, for indulging us and taking part in that activity. We can go to the next slide. I did want to just, we already talked about some of this, but I want to hit up, all of the important times you should wash your hands. And again, talking about this is really the, building block of public health with respiratory illness season. So always wash your hands when you prepare food, before and after you eat, before and after you change a baby's diaper, after you use the bathroom, handle animals or animal waste, sneeze, cough, blow your nose, touch your body, hair, face, handle garbage. Whenever your hands are dirty, wash, wash, wash. We can't wash enough. So, thank you again. And, that's just one example of one thing that we would like to do in these study sessions is, again, spend a lot more time showing you what we're doing in the community and not telling you what we're doing in the community. A little bit of both, having some interactions with you all, just thinking things in a different way. So if you can go to the next slide, Pat. Here's some questions that I want to spend about 15 minutes exploring with you. Take some time. Before we dive straight into them, I just, for an example, I went on our website and looked at a directory of programs, services that we're connected to, not that we run but just, it's not an exhaustive list, but I thought I'd just read some of them aloud, because you might not know all the things that we do at the health department. And there's so many different areas that public health is involved in. Assessment, evaluation, and epidemiology, behavioral emotional health, Black infant health, children and youth with special healthcare needs, chronic disease prevention and management, communications, communities of focus, contaminated property cleanup, drinking water, environmental health code, family support partnership, food safety, general communicable disease investigation, hand washing, we just did, health equity, healthy community planning, healthy housing, healthy resilient children and youth, HIV and AIDS prevention, immunizations, injury prevention, kids and lead. It keeps going. Long-term care, maternal child outreach, Meds First, mold, natural yard care, nurse family partnership, on-site sewage, opioid task force, opioid treatment services, oral health, outdoor air quality, parent, child, and family health, perinatal collaborative of Pierce County, PFAS, pollution prevention, pool and spa safety, provider resources, public health emergency preparedness and response, public records, racial equity, recreational camp health and safety, refugee and immigrant health, school health and safety. Keeps going even more. Secure medicine return, sexually transmitted infections, South Tacoma Groundwater Protection District, street medicine, sudden unexpected infant death, surface water, Tacoma smelter plume, dirt alert, teen mental health first aid, tobacco-free living, tuberculosis, vital records, waste management, water quality and protection, wildfire smoke, youth behavioral health, youth substance use prevention. There's more and more and more. Again, that's not an exhaustive list, but that's just one directory on our website of a lot of different items that we can take you to and we're involved in. So with all of that, again, let's spend about 15 minutes. I'd love to hear from you. My colleague Jessica Gailey from our Environmental Health Division is taking notes of what you say, and we really want to hear from you. Have these study sessions the rest of this year, the next 11 study sessions, be more interactive, more engaging. Let's start with the first topic. What topics interest you? Why don't we just focus on that one first?
Go ahead. Yeah, go for it.
So alternate board member Denson emailed me as soon as she's not here. So I'll break the ice by saying hers. She is really interested in understanding the partnership with the Medical Reserve Corps, if there is one, and how we work, I think, which is tied to like some of the work we do when there's an emergency and that kind of. And I know during the pandemic, we worked with the Medical Reserve Corps as well. And then the other part that she was interested in is around suicide prevention and awareness and education. So tying not just youth, but I know we do have a youth segment that we focus on through our teen mental health and some of those other ones, but also just suicide and depression. So behavioral health parts related to depression. And she's interested in potentially having a suicide summit. Might need to think of a different name, but idea of really bringing people together and thinking about that. So those were council member or board member Denson's. So
Excellent. Yeah, thank you for sharing. I'm definitely involved in a lot of that work.
Board member Sadolgi.
I was writing a few things down because I skipped to the end on this. By the way, I think I washed my hands like 3 times longer than I normally do, and I still had stuff on my hands. So that was a very good demonstration for me. It's like I did a good job. So things that I've heard in community, and I realized I didn't quite understand some of the details were things like, well, if I wanted to go and open a restaurant or have a food truck, like what's the process? Like what would I have to go through just as a way to kind of, like one of the number one ways that I think the health department interacts with the community as a large is doing health inspections for food establishments. Like one of the most common ways communities seeing the word Tacoma-Pierce County Health Department is on the grade. So having maybe some more kind of, it would be a fun activity just to say, hey, if I, board member Sadolgi was opening up a restaurant, this is what you would go through, and this is how we would help you, and this is where you hear common things that pop up, something like that. Parent, child, family health is really important, especially in the area of Tacoma I represent. I had the fortune of I think my first official kind of thing I did in community was actually help open the community garden on the east side when that opened. So understanding some of our direct community activities, especially as it pertains to trying to get the word out about our resources around childcare, child and family health access. That would be wonderful to kind of see that together. And then the last 2 I put down is, maybe there's a way to also talk about language access to all of our resources. We have a large portion of residents all across the county, actually, and it's growing, where English is not necessarily their first language, and what are ways that we can, what are some of the things we're doing to help bridge that access gap that comes with just language barriers. And if that wasn't enough,
Great. Yeah.
I'm realizing that I'm getting to the point here, and maybe this is something more for me to think about, which is, are there ways of enhancing our services with partnerships with other organizations that are already out there? Are we doing that? Are there barriers to doing that? Maybe there's statutes or something. Organizations like some of the hospitals here, or some nonprofits that are trying to do health-related work, or where some ways of us, potentially, this is more of an idea than anything else, as a way to kind of enhance some of the work. So those are the first few things that kind of came up to mind.
Great.
Thank
Yeah,
you.
all great stuff. Thank
That's
you.
great. It's a lot. It's a few things. Board Member Reisish, or who was first? Okay.
So as I was thinking about actually this session before I even came, what do I want to know? And I think we talk a lot about food safety, and this will go along with what board member Snelga just suggested. I would love to hear what a day in the life of a food inspector or a restaurant inspector is like, and what they find and what they worry about. We talk about the process, but I don't understand the nuts and bolts of how that all works. Similarly, there was a bit of a controversy, I guess, about whether we can allow people to do their own septic inspections. Well, I want to know what a septic inspector does and what do you look for, just to understand better what that is like. And I think the part that those two things join for me is that it's all things that we hear fussing from the community about, particularly restaurateurs get frustrated with us or with the health inspection or the food inspection problem. I've had several phone calls from people I know since I've been on sports saying, hey, how come you do, when somebody tells me that. So I would love to understand better how those things work.
That's great. I was just going to say, sorry to interrupt, but that's great. That's some of the stuff that when we've been talking about this, we've been talking about those specific issues too. And we know that those are a lot of things that come up. And, I mentioned earlier, we want to still probably keep a lot of these study sessions in the room. Field trips are things that have came up, but maybe down the road is a possibility. But we do know that going out into the field, seeing like what does an actual septic inspection look like, or what does food inspection look like, can help people really understand what's happening.
That would be great, but it's also a half a day out of your life that's a little bit hard for some of us when you're busy.
Yeah. So. But I mean, maybe there's a way we can bring some of that here into the room.
Exactly.
To start, for sure.
That was what I was thinking.
Yeah.
Thank you.
Barbara Olson.
I would be curious just about learning a little bit more about kind of the historical perspective of how did the health department even form and why. It's probably 100 years ago, but what was the motivation then, and kind of what was the mandate? And I realize it's been an ebb and flow and things change, but I'm just curious, what was the initial motivation and what is our current motivation, and is it still the same? Has it changed? And I don't know, and maybe that exists. Maybe there's some web page on the website that explains all of that I'm not aware of, or maybe there's some document around. But I think just the historical perspective of how we started and how we got to where we are and what's changed, and yeah, that would be my input.
Great. Love to hear it. Yeah, I don't think we have a comprehensive historical document like that, but definitely we'll add that to the list of topics.
Okay.
I believe Exec Mello is on the line, so he can chime in. He and I chatted about some items that he's interested in. The first is vaccines. So trends and just in terms of what's happening, especially with changes from the federal government in terms of guidance and what are we doing locally to address that. And then some programmatic updates that the county partners with the health department on. So street medicine, safe storage for firearms. So there's funding in the budget for vehicle lock boxes, opioid task force, that sort of stuff. Executive Mello, anything else you'd like to add?
Thank you, Board Member Merrick. I think the only other thing I would add is using the conversational time during study session to continue to dialogue about the implementation of our strategic plan and follow along on what's going well, where we're seeing hurdles, how are we iterating to make progress on our strategic plan. So just keeping fidelity to the plan and keeping an eye on implementation of our strategic plan. Thank you.
Awesome. Great. Thank you for all of that feedback for sure.
I think I'm going to piggyback on a couple things. One was Councilmember Denson's, our board member Denson's interest in, suicide resources and understanding, tackling that. I think that I take it a little bit broader, and I'm thinking about what's mental health access for different communities, color, and how that fits. Just anecdotally, I know a couple friends who use therapists, for example, and they're looking for culturally appropriate. They're looking for people who look like them, who have similar lived experience, who they don't have to keep starting off at the beginning explaining things. And some people say, well, therapy is therapy. You can go to anyone, right? But then there's all this, is access, and it's also providing, communities who don't have our lens to be able to access mental health services. Talk about suicide prevention. Also, talking about with the mayor's point, board member Olson's point about maybe also how our model of Tacoma and Pierce County is different than some of the other models around, and how that works versus, let's say, Seattle King, which is primarily, one of those, and then so just the differences in the models, because and sometimes what made sense at one point maybe needs to be looked at another. Also, gun violence prevention is a big thing in my district, and gun violence continues to be. So, some of our summit that we did the other year was great, but then how to end the county helping to provide some greater access for the gun storage, in automobiles is great. But then how do you continue to keep this at top of mind, and how do we continue to have those conversations? And I think the last point I will bring up is data. And we continue to have this discussion, but I know that, recently we've had staff move on from, our GIS. And I think that we have been talked to before and said that sometimes when we work with other agencies, the data sets are different. They don't always match up. So what looks like, how is one sheriff department's data not in sync, with ours versus the medical examiner's office versus this? We all understand the importance that we're only as good as the data that we're operating with and the people who are investing in those. And I also think about how the federal government stopping, for example, the USDA doing a food insecurity survey and understanding, so they're stopping measuring it. So how do it falls now to the state and then the locals to figure out our own ways of measuring and then addressing it? Because unless we know the scope of the problems in our communities, we don't have real good ways of addressing it, if it's an issue or not. And so, just around the data sharing in itself, but also why is it so complicated, and what can we do about addressing easier sharing and access to each other, and what are the challenges? Because sometimes it's also one agency will be like, well, this is proprietary, or this is the software modeling is different. So just going into a deep dive and understanding what the complexities are in those.
Sure. Yeah, that's all great stuff. Appreciate it.
Board member Herrera, did you have any comments or you would like to make? I'll give you the opportunity there.
A lot were touched on. I did was thinking about aging and elderly care type stuff and support for chronic conditions for seniors in particular. I haven't heard that one. I just had some interest in that.
Great.
Excellent.
Thank you, Vice Chair.
Thank you. Many of mine would just be kind of adding on or adding a nuance to things we've already heard. The interests in around STIs. Pierce County doesn't do as well in that space as when you compare to other counties. So just understanding where we are with that. And then the other one that is kind of related to what board member Yambe was talking about is our ILA. We've been talking about potentially needing to kind of crack that open and potentially look at it. Study sessions may be a good time to kind of chunk that and do that thinking as a group, so that we can start that conversation about what do we want the future of our health department to be? Is this model working for us? And if it's not, is there a change? If it is, then how do we update our ILA so it actually is 21st century language? And then always love getting updates on our family resource centers, what they're doing and the communities of focus. The last one is separate, and I really haven't heard this kind of come out. We talked a lot about trusted messengers during COVID. And one of the things that I really asked last year, and it shows up in our strategic plan, is really continuing to kind of create and keep those relationships. So just getting an update, what's the health department doing with some of the communities that we had to work so hard to get in the door with, to get them to trust us, to do vaccines, to understand masking. What are we doing to continue to maintain those relationships? So if and when the next pandemic or just standard hand washing healthy behaviors is going on.
Yeah,
I think
absolutely.
we've got 6 years
that.
worth of study sessions. We've just thrown it. I will just say
A lot of topics. Hey, I mean, the one thing is when we're still talking about topics, some of these topics don't have to be study session. They could be regular meetings too. So it's great to get a list of topics, and then we can dive more into the study session specific stuff. But I love getting the more ideas, the better. It's great.
Yeah, thank you. This is a really good conversation. I think most of the topics that I was really interested in have been covered. So a few things that I think would be interesting also is in relation to how economic conditions impact health and how we can maybe move the needle and work with partners in order to impact that positively. I also think about board member Herrera brought up our seniors and something that I've noticed a lack of senior enrichment opportunities. Thinking about the whole life and enriching opportunities for our senior citizens out there. Obviously that's something we have to work with partners on as well. I really like the idea of field trips, and maybe it's not a study session. Maybe it's something that we break up the board and do one and the other, so there's no quorum or something like that. But I've had the opportunity when I was on the food advisory board to actually join one of our inspectors and go to several different types of quick service restaurant, full service restaurant, and just seeing the different types of things that they're looking at was very, very helpful, and understanding what they were doing and how they're trying to keep the public healthy. And I think that would be really beneficial, I think, for all of us on the board, but then also the other inspections that happen, like the septic. And I'm really curious of like how on the ground it looks, like that a septic system looks, and okay, if is it close to a waterway, what kind of concerns are we looking for, like, and just all the things that we see on paper, but I'd love to actually see it in person. And I think that there's opportunities also to do those field trips, obviously maybe not as a study session, but out in the county as well. I'm more than happy to travel to Edgewood and go see what's going on out there or something like that. Grease traps is of high concern, not just for the city of Tacoma, I know for the health department as well. Maybe understanding a little bit more about that. Man, what else is there? I'm just throwing stuff out there. I think it was touched on earlier by you, but youth violence, very top of mind for me, and especially how it coincides with gun violence in our community. It's a very high, it's a problem. We all are aware of, and I think we can't talk about it enough. And yeah, I think that's pretty much it.
Well, that's a lot, and that's great, and that's what we're looking for. So I'm glad that we sparked this discussion and conversation, and this is still that's the first question on here. So those are the topic lists, and again, a lot of those topics could be at regular meetings. They don't have to be at study sessions. We're going to take that and curate it and see what we can bring you quickly. See what we'll take down the road. Be in contact with you about that. But I don't I don't want to do the same for each one of these questions, but because I know I don't want to keep us here all day, but let's look at, specific to study sessions, what type of, as opposed to the topic, what type of activities, how we could use this time in a different way. Again, instead of maybe having you all sit here, maybe we're sitting around in a group, maybe we're bringing in some of those partners that you all mentioned and they're talking to us about our connection to them. What are some just activities not thinking about the topic, but different ways that we could use this time and engage with you that you would appreciate? Any thoughts?
I kind of feel like I threw my answers to all these questions into what I said before, but I think
Sure.
all of those ideas are pretty interesting to me and make this more lively and, as you say, less didactic, which would be great. So
Awesome. That's what we're looking for sure.
I agree. I would just add recipients of the services. So if there's people that are receiving the services, that's always helpful to hear from them, or partners, even restaurants, if we're going to talk about food inspections, that sort of thing. I think it just gives a more well-rounded perspective.
Cool. All right. Well, I'm not seeing any other, but I want to say, this is just the beginning of this discussion too. On the next slide, you'll see my name and contact information, but of course, I'm not the only one you can contact about this. I'm leading this presentation. It's a group here, but we really do want to look forward to 2026, this year of study sessions, presenting them in a different way, being a little bit more strategic in how we're doing them. So you're getting more information in a way that you're looking forward to being here to receive that information, and how we can just improve upon everything. So thank you for taking part in this discussion. If you have more thoughts down the road, feel free to reach out to me or others, and appreciate it. Great meeting.
All right. Thank you so much. That's the end of that portion. Any final comments from the board? We don't have an executive session today. We do not. All right. We thank you all for being in attendance. We stand adjourned. It's 3:52.